everyone, it's Margaret Manning here, and welcome to 60 and Me. This is the place where women over 60 come to be inspired. My guest today is Dr. Leslie Kernisan. Dr. Leslie is a medical doctor. She's also a geriatrician, and her specialty is geriatrics. And she has a fabulous website. It's called betterhealthwhileaging.net. And on that website, she provides practical advice for how to deal with the aging problems that older adults face. So it's great to have you here, Dr. Leslie.
Thank you.
You know, I'm so happy that you're here because we're doing a couple of interviews today on, the aging body, how we deal with the changes that we go through. And one thing that is a big concern to us is brain health. Mm-hmm. We know it's important. We know sort of what we have to do to stay healthy. But you have put together a fabulous checklist of basically a guide to brain health. And you came up with some really interesting angles on how to look at brain health. So can you please tell us about your checklist?
Yeah, so it's called How to Promote Brain Health. And I created it because I realized that often I needed a place to sort of point my patients or my audience to, here is what I recommend for sort of optimizing your brain. Yeah. And because I'm a geriatrician, I actually mostly take care of people who are older than you are, many of whom have cognitive difficulties or maybe even memory problems. And I realized that our suggestions for optimizing their brain function apply whether you're 60 or 85 with Alzheimer's, because, the core principles are actually the same. So I created that list, and I'd be happy to take you through it. I found that several of them people have already heard before because there's been a lot of interest in brain health and the pillars of brain health. But I do have two that people often haven't heard of, which I especially focus on. And
now,
so
just before
happy to take you through them.
That's great. Now, before you start, though, I've got to say that we have done a lot of videos on healthy aging. It's really important in brain health. And everybody sometimes expects, another doctor Margaret's talking to, maybe she'll say something that's like different. And it's like, guys, there's no magic bullet here. Like your brain is your brain and your body is your body. And like there's a couple of things that you just cannot escape. This doctor, you, Leslie, are going to say similar things, but stay with it because Leslie's got some really interesting ones at the end that I hadn't thought of. So go for it. Yeah, go ahead.
Well, I'll start with the first one. And one of the most popular articles on my website is 4 types of medication to avoid if you're worried about memory. And I wrote it after I'd actually been at a big party where there were people of multiple generations. And I spoke to several older people who told me that they had noticed changes or, were concerned about changes in their spouse. And they would all say, well, what can you do? It just happens. And I thought, oh my God, there's lots of things you can do. And one of the key ones that people often don't think about is to identify and stop medications that we know dampen brain function. So, and that is something that I'm often surprised that I don't see on these pillars of brain health things. Now, there was the National Academy of Medicine in the United States issued this groundbreaking report a few years ago on cognitive aging. Where they sort of summarize all this information on how the brain changes as it ages and how we can maintain the best possible brain health. And so they have an action guide. I can send you a link to it that you can share with your audience with 6 particular suggestions. And third on their list was to manage your medications. So that is one of the few places where I've seen it brought up. So people are often surprised to find out that they're taking medications that dampen brain function or have been associated with developing cognitive impairment or even dementia. And the ones to look out for are 1, benzodiazepines. So these are medications like Valium or like Ativan. The generic name is lorazepam. Or Xanax, which people take for anxiety. They're used for anxiety, they're used to relax, and they're often used for sleep. And they, first of all, for people who are already having any kind of memory difficulty, they make them worse. They have been associated in some research studies with developing dementia or possibly accelerating it, but then other studies have contested that. So some people say, oh, well, it's not for sure proven, but in geriatrics, we are very careful about spotting those medicines and encouraging people to taper off if at all possible. And they have an added problem, which is that they're terrible for balance and they're associated with falls. So by avoiding them, you kind of get a double benefit as an older person. So that's one type of medication. And it's actually great for people who are in their 50s and 60s to be aware of it, because that's a great time if you've been taking those medications for a few years or even several years, which some people have. It's a great time to work on the process of tapering off and finding another way to manage insomnia or anxiety. Because otherwise we end up with people who are in their 80s and starting to slip with their memory, and then it's very hard to get them off because they get stressed and their memory gets even worse. So
that's a good one.
I encourage people to start early. So that's one type. The other sedative medications like Ambien, there's, haven't been around for as long. But I encourage people to minimize their use of that too. We do know that people do less well on cognitive tests the next day after they've taken Ambien. What the long-term effect is, nobody knows for sure, but it's, there are safer ways to learn to sleep. People don't realize that, but you can learn to sleep without them.
And by the way, Leslie, let me just interrupt you to say that you're a medical doctor, so you can make these claims and you can make these comments, but I would encourage anyone who's listening and is using Ambien or just has an opposing point of view on this, go talk to your doctor or do your own homework. I mean, I think what Leslie's mentioning here is from her experience, and she's read a whole lot more than I have for sure. And just to say that, that you are a medical doctor, so you are able to make these comments from your own experience and the research that you've done. Just want to make sure people know that.
And I actually, there's a wonderful geriatrician in Canada who did a study where she created a pamphlet about taking benzodiazepines and other sedatives that gave people information on the risks and suggested a tapering schedule and encouraged them to read it and bring it to their doctor. And she did a randomized trial. They gave it to pharmacies and gave it to people. One group didn't get it. And they found that people who received it, a surprising number were able to stop or reduce their dosage. And that was proof that by giving people a really useful information tool, you could motivate them and empower them to go to their doctor and actually make a good change.
Make a decision.
So I would encourage people to take a look at that pamphlet, and I can share a link to it if they're interested. But yes, always talk to your doctor before stopping this kind of medication. Very, very important. So the other class of medications that has been associated with cognitive decline it's a whole broad group that's called anticholinergics. And these are medicines. So acetylcholine is a neurotransmitter in the brain and elsewhere in the body. And a medication for Alzheimer's, like Aricept, is actually meant to increase it. And what people don't realize is that lots of medications that are commonly used impair it. And so some common ones, probably the most commonly used one in the United States would be something like Benadryl, diphenhydramine.
For asthma, or not asthma, for allergies.
For allergies, but a lot of people use it for sleep, or it's included in over-the-counter medications like NyQuil and Tylenol PM. It's the sort of sleeping agent in all those over-the-counter medications. Sedating medications like that, sedating antihistamines are anticholinergic. Certain medications for overactive bladder are anticholinergic. I mean, these are basically medications that usually they make you drowsy and they give you dry mouth as a side effect. So certain muscle relaxants, I have a whole list of them.
I was just going to say, on your website, I know you've got a lot of resources and lots of lists. So maybe we could move on to the next thing and leave medication, because you've got so much information that people can check. But what other things are on your brain checklist that people should think about? Now, I mean, of course, we talked earlier about exercise. I mean, that's an obvious one. I mean, everybody now can wake up because you've fallen asleep briefly while we've just mentioned the word exercise. But what else is on your checklist that you need to think about for aging brain?
Well, the other one that's on the checklist that often isn't included, but again is included on that tip sheet from the National Academy of Medicine on cognitive aging, is to prevent delirium. So delirium is that condition of worse than usual mental function that happens to older people when they get sick. And it often happens in the hospital. That's where most people encounter it, is that an older person is hospitalized, they may or may not have surgery, and suddenly they're totally confused, their memory's terrible, or they're seeing things, or they're hallucinating, and that is called delirium. And And what we know actually is that people who develop delirium have a higher chance of developing dementia later. And if there's somebody who already has had some memory problems or maybe been diagnosed with Alzheimer's or another dementia, having episodes of delirium is associated with faster cognitive decline afterwards. Wow. So it turns out that 40% of delirium cases we believe can be prevented. And so the thing to do if you're a person who wants to take care of your brain health, delirium often comes on just when people get very sick. There's not that much to do about that. What you can do is if you're going to be hospitalized electively, you're going to be hospitalized for a surgery, maybe a joint replacement or another procedure, you can actually try to take steps to reduce the chance that you'll get that delirium. And you can do one of two things. You can look for a hospital that has set up a special unit for older adults. They're called acute care for elders units. They're usually for people who are older than in their 60s, but they're units that are designed to provide older people with extra support, because one of the things that tips people into delirium is the hospital is such a stressful, non-recuperative place. You get woken up in the middle of the night. They don't get you out of bed early enough. They give you medications to help you sleep, like Benadryl, which actually provoke delirium in older people. They do this. It's astounding, but they do this. They leave, older people can become constipated. Older people may not have their glasses and hearing aids, So they actually have developed ways that if you kind of structure the environment so it's more restorative, people are less likely to get delirium. And so people can look for a hospital that has a special unit, or they can ask, they can say, I'm very interested in preventing delirium and reducing my risk of delirium after this procedure. I would ask the surgeon and I would ask the hospital, and I would say, do you have a program with your nurses or your hospital staff to help older people avoid delirium? Because this is important to me. So you can do those things. And then I can share a link, but there are some tips on what people and family members can do before the hospitalization or during that, again, try to minimize those extra stressors on the person.
This is really interesting. Actually, it's funny you should talk about that particular one, because we have one of our bloggers has just had a hip replacement, and she wrote about it. And it was interesting, the feedback that she got to that article, where people, really had done almost things you've just suggested, but in a way that they created their environment. They took things with them. They kind of anticipated that it might be stressful, so they took some little cuddly things that they knew, or just pajamas that they felt comfortable in. They created the world like you described, so it helped them to not stress. And,
Right. Yeah. Well, one study found that sort of, I think it was 45% of older patients who had heart surgery developed delirium. And of all those people, 6 months later, there were still something like 30 or 40% of them that hadn't recovered to their previous cognitive baseline.
Maybe we should just call it like a panic attack or something, because delirium sounds really crazy. It's just a word, isn't it, that's so powerful? But maybe it's kind of...
it's a word that I think more older people should know. I mean, it's something to learn about if you're older, because hopefully you won't get it, but you'll see an older relative get it. You'll have an older friend get it, and you want to know, first of all, if you see somebody, if you visit a friend in the hospital and they're very confused, you need to know to bring that up to the doctors, because actually doctors often don't notice unless family brings it up. So that would be another one of the brain health suggestions that I think is really low on people's radar, but is actually important to know about and to consider, especially if you have a choice about where you get hospitalized, or if you're in a position to do a little preparation before being hospitalized. It's not always the case. I mean, we often get hospitalized just because we're suddenly sick or there's an emergency, but if you have that choice, that can be important. And then otherwise, the other items, I mean, exercise, very, very important. Avoiding chronic sleep deprivation is important. So lots of older people have sleep difficulties. You don't want to turn right away to using one of those sedative medications. Instead, you want to make sure that your sleep problem is correctly diagnosed. I have an article on that, the top causes of sleep problems, and evaluated, because that's what leads to the right management. And then if it is just, insomnia, anxiety, there are non-drug ways to help people sleep that have been shown to be effective. There's cognitive behavioral therapy that's now available online for people. So that's very important.
You can also listen to audiobooks.
Yes.
This always
Right.
puts me to sleep. Or
I know.
simple meditation. I mean, there's
Yeah.
certain practices that are, like you say, they're free, they're non-medication, and they actually do work for
Yes,
some people. Yeah.
there are certainly ways, but if people don't realize that easy approach, which
Yeah.
often the doctor gives you, that sedative pill, if they don't realize that there's actually a lot more risk there,
Mm.
they may not make the effort to find another approach.
Yeah, important.
Finding ways to manage chronic stress is really important, and that's again where some of the lifestyle techniques that you mentioned, yoga, meditation,
Right.
enough exercise. I think managing chronic stress is especially important for those women who are in a caregiving situation,
Mm-hmm.
who are caring for someone else, getting help with that, right? Asking for help, learning ways to cope, both with your stress in general, or if you're stressed because you're caring for someone with dementia, learning some better techniques for managing difficult situations. So that's really important. Getting treated if you have any anxiety or depression. That one's not always on there, but a lot of people just try to tough it out, and I think it's not so great for the brain. It's not optimizing your brain health. So
yeah, I think a lot of it's got to do with being a woman too. Like all of our
Yeah.
lives, we've kind of learned to cope with things and manage it, like you say. And there's a lot of older women, because of the ratio of men to women, die younger. That a lot of women are by themselves. They're living
Right.
alone. They say, "Oh, I'm okay, I'm fine," but in their little hearts, they're not. They're struggling. There was it wasn't funny, but there was a video I watched the other week, and it was about a woman having a heart attack. And it was
Oh, that's right.
Have you seen that?
With that actress, yeah.
And
she's
she's like,
I'm still taking care of my kids.
exactly. Like, I got to pack lunches for the kids at school, and it's just that.
I know.
But it's so true that you immediately you think, oh, well, just a minute, I got things to do. I can't worry about this problem that I've got.
Right,
anyway,
right. Yeah.
it's not
And so yes, I think women often don't take care of themselves. They're so busy taking care of others, or feel like they don't quite there are more important things at that moment. But not only is it a problem in the moment to have all that depression and anxiety, but it is associated with developing cognitive problems later in life, and I think not everybody realizes that. And so you want to take care of it.
Yeah, it's super important.
Don't put it off for too long. Other things to do, people have usually heard this one, but just addressing your cardiovascular risk factors. What's good for your blood vessels around your heart is also good for the brain, because the brain is nourished by blood vessels. And so addressing high blood pressure if you have it, not smoking, taking care of your blood sugar if that's been an issue for you. Those are maintaining a healthy weight. Those are all super important as well. And I may be forgetting them, but
no, I mean, honestly, you can stop there, because
the rest are the usual brain health pillars. They really are.
You've given us so much, and actually, the link to the guide that you've done, the checklist you've done, I'll put that in the article too, and you can go and check out. There's 8, really proven things that can help you with a healthy aging process with regards to your brain, and I would highly recommend you go out to betterhealthwhileaging.net, which is Leslie's website. It's full of information, and more than information, it empowers you. It gives you the tools to be healthy and as you get older. So
make sure you're getting the best health care.
Yes. I want a doctor like you, though. I mean, why can't we just have lots of doctors? Can we just clone you?
I know. I created this site as the next best alternative. I would love to clone myself, but since I can't, I feel like, well, not only should all doctors and nurses know some geriatrics, but every person who is involved with the health of an older person. So if you're older, that's you involved in your own health, or you're often helping an older parent, an older spouse, older friends, that we could all know just a little bit more of what is in our specialty, and I want it shared with the world.
Well, you're doing a great job.
Thank you for giving me this opportunity to share with your audience.
Thank you so much, Leslie. Take care. If you enjoyed this video, please subscribe to our 60andMe YouTube channel and also visit our website. We are a strong and dynamic community of women over 60. We're challenging aging stereotypes, and every day we share fascinating stories, interesting questions, and great conversation.